I was in the Air Force during the Korean War, and I was discharged in 1954, and I had the GI Bill. So that made it possible for me to go to any school that would take me, that I could choose. And the school that I really wanted did accept me, the University of Chicago. So I spent 7 years there in undergraduate and medical school. And then went into my internship down in the Panama Canal Zone where I had lived before. And then did my training in psychiatry at Cincinnati, which was a very respected place for learning psychodynamic psychiatry, for learning psychotherapy. The psychiatrists that came out of that training would specialize primarily in psychotherapy. I had an experience during my internship that has helped to inform me greatly about the way the mind works, and that was I had my rotational pediatrics, and this baby girl who had just been born days before had to have surgery, abdominal surgery, because she couldn't swallow. She would swallow milk, but she couldn't keep it down, and she'd throw it up. And she had she had a condition called pyloric stenosis, which is a closing down of the lower part of the stomach, which prevents food from going down into the intestine. The surgery for that is to open up the abdomen, to release the stomach, to cut away the bottom part of the stomach and the upper part of the intestine, and then sew them back together so there would not be this blockage by this muscle. They did that with her. I wasn't there at the surgery. Somehow, the fact escaped me right at that time, but it came to me later. This surgery was done without anesthesia. And it was done without anesthesia with these babies until 1987. Only then did medicine begin to use pain control for infants, because it was thought, well, infants won't remember it. It was thought that it's just the cries and the reactions are just nervous system reactions to this. I had the job sometimes of circumcising newborn boys, and they would scream bloody murder. And my boss would tell me, you just get the job done well. You've got to do that well. Don't be distracted by the baby's crying. You've got to keep focused on what you're doing. And a baby won't remember a thing about this. To explain about the situation with infants undergoing surgery without anesthesia, let me first say what anesthesia is today. Today, anesthesia is a cocktail, like 3 medications. One of them, the most important, of course, is pain control, so a person doesn't feel pain during the surgery. The other is an amnestic agent, so that the person, in case they did feel pain, won't remember it. Also, it's a relaxing agent, too. The third one that's used in abdominal surgeries and major surgeries where the muscle mass of the body has to be dealt with is a curare type drug. It's a paralyzing drug. And this medication does not give any pain relief. It doesn't even put a person to sleep, but it will paralyze a person entirely, where they can't move a finger to get something across to people. And the person undergoing surgery has to have then be on a respirator. They have to have artificial respiration, or they wouldn't breathe. It paralyzes the breathing muscles too. The babies that were operated on before 1987, they were given a medication called pancuronium, which was a paralyzer. And the babies would be paralyzed so they could get that that endotracheal tube implanted in the windpipe, and so they could get the artificial respiration going, and so that that when they would do the surgery, that the muscles would not cramp up while they were doing it. Those babies were indeed unable to move. There was no protest, but they felt the pain, and they were aware. They were not asleep. The two major things they were doing, one was the open heart surgery, and that was for congenital malformations of the heart. The other was the pyloric stenosis that I mentioned. But there were a variety of heart conditions where they would open the chest, and they would operate on the heart, and they kept the baby alive by artificial respiration, and they sewed them back up. The baby that I saw, the first one, that baby after surgery did a remarkable thing. The baby would look like she was dying. She would stop moving. She would stop crying. Her respiration was slowed down. It looked to me like an emergency. But it just went on for a while, and the baby did continue to breathe, and the baby, got through that, and then would come out of it. And when it come out of it again, it would be like the baby's coming back into this awful world, and she would be so afraid. And it was inconsolable. Her mother could not help her to be relaxed at all for a long time. And she kept having these spells. We know what these spells are now. They are spells that a person has when they are in a trauma. And those spells, as we understand them now, are freeze states. And that's a natural, instinctual reaction to an overwhelming situation. And it can be life-saving for animals and maybe people, like playing dead in situations. But it's not a choice. It's an instinctual reaction. And it wasn't until 1987 that a wonderful researcher, Dr. Aman, proved that babies do remember, and that babies do suffer from pain, and that babies do react to pain as one reacts to a traumatic event. Their cortisol levels go up, just like it does with an adult after a trauma. And so these babies were all undergoing traumatic events. Whether they were all traumatized or not, I can't know, because somehow the problem was always underground. Even since it was realized that this happened, even since people realized they themselves, who had surgery as infants, had no anesthesia, nothing has happened in general for people to act on this knowledge. We don't have people coming to us in groves trying to get this trauma treated, and we would have expected that. But what we both learned from that was, of course, that babies do feel pain, and babies do remember. And the memory that babies have that is imprinted in the brain gets stirred up over and over and over again. And when a person grows up and becomes adult, they can't know why it is that they feel so bad. They can't know why it is that they feel so unsafe in the world. They can't know why it is that they can't trust people and that they always have to be on guard. They can't know that that's because of what was done to them when they were babies in these operating rooms. So it's surprising that hasn't happened, but it has added to our knowledge about pre-verbal trauma, and it has added to our procedures such that we now routinely help a person to process those very early pre-verbal traumas. And that turns out to be a wonderful thing, because it helps people to get over that trauma phobia problem. That once they process something and they didn't fall apart, and they got all the way through it, and the session is finished, and lo and behold, they're still okay, it makes a world of difference for the next process, and the next, and the next. It has to go on after that. So, anyway, that's an example of something that was developing over a long time that we just had to learn from what we saw.